couple of Mississippians. Dr. Barry Bertolet joins us this morning. He is the president of the Mississippi chapter of the American College of Cardiology. And Crystal Reed joins us as well. She's from Maben, Mississippi, and is a Mississippi resident who is dealing with hypertrophic cardiomyopathy.
So hypertrophic cardiomyopathy is really when your heart muscle gets to be too thick. And when your heart gets really thick, then it cannot fill with blood to be pumped forward. And so when you hear about the football player that drops dead on the football field or the basketball player, this is what they have.
Crystal, let's talk about your situation a little bit. A native Mississippian, you are living with HCM. Give us a little bit of your story.
I have a family that is totally littered with heart disease. And I myself didn't realize I had it until, I started having problems. I had a life, and then I didn't.
Mm-hmm.
I finally found a medication that was going to save my life. I was on a trial for 18 months, and it was fabulous. I had a life again, and then I didn't, because at the end of the 18 months, Blue Cross Blue Shield refused to pay for it.
Medicine and specifically that we're talking about is mavacamten. What's the rationale with Blue Cross Blue Shield of Mississippi not covering mavacamten, specifically as we were talking about in Crystal's case?
When we look at the Blue Crosses across the United States, all of them cover this medication. So this is unique to our state and unique to our Blue Cross of Mississippi. Even despite us calling multiple times, I can't even get them on the phone to have a conversation to advocate for patients like Crystal. So they ignore that the drug even exists, and then they stonewall doctors trying to advocate on behalf of their patients. If Mississippi is the number one leading state for cardiovascular death in the nation, why do we avoid talking about it with the insurers that choose to operate within our state? There needs to be a conversation between insurance companies and then physicians that may have some expertise in the area that we're talking about. And then more importantly, I think that the insurance companies themselves need to listen to their own advisors. And so with the case of mavacamten, the Blue Cross national advisors had said this drug needs to be approved and covered. And then our Blue Cross of Mississippi has opted not to even listen to their national advisors.
We're all about having a conversation here. That's the way I've tried to build this show. Let's talk about the issues and hear both sides. Anybody at Blue Cross Blue Shield of Mississippi that would like to have a further discussion about this on the air in a public forum, you have an open invitation.